Very good morning to everyone. And today's topic for the discussion is about the viral infections, the measles, mumps, and rubella. Let us see about the measles first. Measles it's an acute viral infection that is characterized by a final stage with a maculopapular rash erupting successively over the neck, face, trunk, arms, and legs, and is accompanied by a high fever. Primarily, it's an acute viral infection. It's a highly contagious viral disease and is caused by paramyxovirus. The incubation period for the respiratory acquired infections is 14 days. And if the infection acquires parentally, the incubation period is 6 to 8 days. And it remains the leading cause of vaccine preventable death in the children. Regarding the pathogenesis of the measles and the clinical features, mainly it transmits through the respiratory tract. The replication occurs in nasopharynx and regional lymph nodes. Primary the viremia, that's nothing but the virus in the blood, occurs within 2 to 3 days after the exposure. And secondary viremia or viremia occurs 5 to 7 days after the exposure. It spread to the tissues. The incubation period is 10 to 12 days, and stepwise there will be increase in the fever to 103 Fahrenheit degrees, or it may be higher. The other clinical features or symptoms are cough, coryza, and conjunctivitis. Regarding the clinical features of measles, mainly it shows the Koplik spots and 2 to 3 days after the prodrome and 14 days after the exposure. The maculopapular rash, it becomes more confident, and these rashes, the maculopapular rash, begins on the face and the head and persists for 5 to 6 days and fades in order of appearance. The main clinical features are Koplik spots, and mainly these measles have three clinical stages. The first stage is incubation stage. The next stage is prodromal stage with Koplik spots and mild symptoms, and final stage with a maculopapular rash accompanied by a high fever. Hence, in the definition also we have seen it's a viral infection that ends its final stage with a maculopapular rash accompanied by a high fever. Mainly the diagnosis is based mainly on the serology. The serology is very important for the diagnosis. Regarding the treatment, there is no specific treatment for the viral infection. The vitamin A supplements, acetaminophen is nothing but a paracetamol if any pain or for the fever. The bed rest, humid air, fluid and nutrition is very important. The patient is supposed to take more amount of the fluids, and good nutrition will make the patient better. Next infection is mumps. So we have heard the mumps is primarily caused by both virus as well as a bacteria. The virus that is causing this mumps is paramyxovirus. It's a rapidly inactivated by the chemical agents, the heat and ultraviolet light. The painful swelling of the salivary glands is one of the main features of this mumps. It spreads from person to person through the respiratory droplet infection, mainly because of the sneezing. It is most common in 2 to 12 years old children, and the incubation period is about 14 to 18 days. Next, the symptoms are mainly there will be pain in the face, mainly in relation to the salivary gland region. The patient will suffer from the fever, headache, sore throat, and clinically we can see the swelling of the salivary glands, bilateral salivary glands, mostly parotid glands, and swelling of the jaw. These are the main clinical features of this mumps. Next comes the pathogenesis. It also spreads and enters the body through the respiratory tract, mainly because of the droplet infection. And replication of this virus occurs in the nasopharynx and regional lymph nodes. The viremia, that is nothing but occurs at 12 to 25 days after the exposure will spread to the tissues, and multiple tissues will get infected during the secondary viremia. And viremia is common, leading to the organ involvement like the salivary glands, mostly the parotid glands, hence it is called as viral parotitis. Meninges, it's called as a meningitis. Endolymph infection leading to deafness. A major cause of permanent bilateral sensorineural deafness in the children. It may be one of the main important complications of this viral mumps. The virus sheds in the saliva and urine for long periods after the infection. Regarding the prevention, the MMR immunization vaccine between the age of 12 to 15 months first dose, again between the 4 to 6 years the second dose, and again between 11 to 12 years. This is the called as MMR immunization, which should be taken regularly at regular time, which has been mentioned here. Regarding the diagnosis, the physically examining the salivary glands for the swelling, the history of the fever itself helps to diagnose this mumps. The treatment is, there is no specific treatment for this, and ice or heat packs and acetaminophen for the pain and the fever are basic need for the treatment. The next infection is rubella. It's mainly caused by the RNA virus, Toga virus, rapidly inactivated by, once again, the virus is rapidly inactivated by the chemical agents, ultraviolet light, low pH, and heat. It's also known as German measles or 3-day measles. Rubella is a virus. It spreads from person to person through air or closing contact. The virus is spread from 1 week before the rash begins to 1 to 2 weeks after the rash is gone. Regarding the pathogenesis, the respiratory tract transmission of the virus, once again, this virus enters the body through the droplet infection. The replication occurs in nasopharynx and the regional lymph nodes. Once again, the viremia occurs 5 to 7 days after the exposure which spread to the tissues. During the viremia, the placenta and the fetus gets infected. The clinical features of this rubella is the incubation period is 14 days. It ranges from 12 to 23 days. The prodrome of low-grade fever, maculopapular rash occurs 14 to 17 days after the exposure, usually a quite mild. The prevention is by the rubella vaccination to adult and adolescent female, MMR immunization between the age of 12 to 15 months is compulsory, again between 4 to 6 years. Regarding these three, the measles, mumps, and rubella, MMR, it's a common childhood viral disease, may be associated with severe complications of death, more often in adults. The measles may lead to pneumonia and encephalitis. Mumps may lead to aseptic meningitis, deafness, orchitis, and rubella, the congenital rubella syndrome implication, and mainly occurs through the respiratory transmission. These are the common features for all these virus. Mainly, the vaccination uses MMR rubella vaccine. Initially, the 12 to 15 months is a recommended and minimal age, effective at 15 months. More effective at 15 months is the initial dose. MMR is given before 12 months should not be counted as a valid dose. That means what, always it should be given after the 12, better at the 15 months age. Second dose is at 4 to 6 years of age, and contraindications and precautions should for these MMR vaccine is severe allergic reaction to the vaccine component or following prior dose. Pregnancy is one of the contraindication, immunosuppression, moderate or acute illness. These people also, the vaccine is not supposed to be taken. Thank you.